Hello, this is Steve Thornley with Managed Care TV. I'm your host and CEO of carenational Healthcare. We are really excited this week to bring you Dr. Stefany Almaden. Dr. Almaden is an experienced managed care nurse. I would venture to say she's a managed care expert. Is that okay if I call you an expert?
Yes.
Okay, very good. And she's joined us today to talk about the American Association of Managed Care Nursing, their certification programs, as well as their upcoming conferences. And Dr. Almaden, we'd like to welcome you to the show.
Thank you.
I just want to have you give a real brief introduction, and I've got some follow-up questions. But can you just tell us a little bit more about your background? Obviously, you are you're a PhD, but you're also a nurse. Is that correct?
Yes.
Okay, and tell us how long have you been in the managed care field? Walk us through your history.
As you know, my name is Stefany Almaden. I'm a PhD RN with dual masters in nursing. I've been in the industry over 25 years, and over 20 of it has been mainly managed care. I've done the hospital side, the HMO side, the medical group side, MSO, IPAs, ambulatory clinics, community-based care. So, and with my PhD in health services, it kind of allows me to look at the full spectrum of healthcare delivery. And having done it, it's just exciting to see how the operations of the health delivery system work or should work. And with Managed Care Nursing Professional Association like the AAMCN, it's really a joy to be part of that association. And I've served on boards with other associations and been active members in others.
Okay, let's back up for just a second, because I want to talk for those that might be watching our program that aren't real familiar with managed care nursing, or that maybe want to leave the hospital setting or the provider setting and get into managed care. Talk a little bit about your background and some of the specialties within managed care that a nurse can utilize their skills in. What are some of the areas that are served?
Very valid question. I'm also an educator. I've been a faculty member over 12 years. And I see that in my classes as well, because many students come from the hospital setting. And because of magnet status, they're trying to get their bachelor's or master's. And it's interesting that many nurses have not, even today, with the advancement of technology and social media, have not really considered the full spectrum of roles that nurses can play in our current healthcare landscape. So, as I said earlier, with my background, having done the full spectrum of the system, I found a great fit with what AAMCN has to offer. And I encourage always my students to join professional association. This is probably one of the best choices they can have for their knowledge and career perspectives. Because as AAMCN integrate all the different professionals and different organizations in its conferences, you get a variety of topics that kind of triggers that interest in different roles. So a nurse can be in risk management, can be in continuous quality improvement or process improvement, whatever the system would call, or in nursing informatics. These are all benefits of membership with AAMCN, and benefits they can acquire as they join these conferences and network with our sponsors. We have great sponsors for the association that allows this networking and sharing of information that would benefit a nurse's career in managed care.
Okay, thank you. And so, looking, I've been reviewing, of course, your background, and it looks like that one of the main areas that you had some expertise in was the case management field, which is one kind of segment of the medical management arena. There's case management, there's utilization management, quality. Tell us about those types of positions within managed care.
Well, even though we speak of them as separate utilization management, quality management, care management, but the reality is you learn these roles, and this is part of the certification that AAMCN has with if you've seen the acronym Certified Managed Care Nurse, CMCN.
Mm-hmm.
This is part of the program and the areas that nurses in managed care need to be aware of, even though their role may be or quality or case management. However, the benefit of knowing that full spectrum of healthcare is really critical in today's healthcare landscape as we speak of integrated care. So a case manager is coordinating care for a member or a patient for those on the hospital side. But a case manager has to understand the full spectrum of needs and how to work with the different providers. So as you follow a patient that gets admitted or that visits an emergency room, you have to understand their needs as they transition their care to different level of care. So you mentioned, because of most of my work has been in care management, the value really is knowing this full spectrum of the health delivery system and how you integrate care for the benefit of patients, families, and the community, of course.
Thank you, Stefany. This is all wonderful information. We got to get in a quick break, and we'll be back right after this to talk with Dr. Stefany Almaden about the American Association for Managed Care Nurses. Thank you. Well, we're back talking with Dr. Almaden, Stefany Almaden, about the American Association of Managed Care Nurses, and got another question here for you. Okay, so the certification program that's offered by the AAMCN is a certified managed care, I'm sorry, did you say managed care nurse?
CMCN, Certified
okay.
Managed Care Nurse.
And what are some of the initial qualifications? If I'm a nurse and I'm trying to break into managed care, I assume this would be a great certification to have on my resume. Talk to me about what is the length of time that it takes to get the certification, and what are some of the components that you cover within the certification?
Okay, so to begin with, the certification is obviously granted and monitored and awarded by the American Board of Managed Care Nursing. For the requirement is an active nursing license in good standing. Obviously, it's not necessarily defined to a particular role. A nurse interested in this certification can be in in case management, in a hospital, in an HMO. It's not really limited to a setting or a role. We have a prep course that is extremely comprehensive and very educational. As a faculty member, I almost think that this should be a course taught in a university program because it's extremely comprehensive. It talks about the accreditation process, which is critical. A nurse in a hospital or a nurse working for an HMO or medical group needs to understand how the daily work or the daily processes fit into grand scheme of accreditation. Also the legal component, the risk management component, skills learning, negotiation skills, or learning about contracting in a network, and even hospitals these days, they're all, looking into ACO formations and having their own group, hospitalist group or emergency room physician. So it kind of gives that full spectrum to a nurse that is eager to acquire this certification. So learning it is self-paced, obviously, with this home study program. Being in practice helps, but if somebody steps out of practice for a while, it's also valuable to transition back into the workforce.
Sure.
And what we do is typically the exams are conducted before the actual conference. We have 2 annual conferences a year, and I'll speak further about that. So before the conference, we have the testing of these applicants.
Okay.
And the value of it is it cuts on the anxiety because the exams are reviewed, corrected, and the announcements are made typically in the nurse's reception of those that have been granted the certification.
Wonderful. And typically, how much study time, again, are they putting into that? Is it, you say it's kind of a self-paced curriculum. Is there any other institutional, are there any classes or anything, or is it just all, they're provided the materials and then they take the testing when they're ready?
Well, they have the material, again, self-paced, but we also have the mentorship program, which is one of the benefits of joining the association. So a lot of us serve as mentors at any point in time. Like I'll give myself as an example. I'm working with people maybe I never met or heard of, or, answering questions, supporting their growth, their development, and hopefully facilitating their joy in their work and, acquiring further skills.
Sure.
So it's the networking piece is extremely helpful. The mentorship is helpful. I get a ton of emails, from folks I barely met or talked to, asking questions. It's a value you can't really measure, but they can choose multiple venues to prepare for this exam.
Okay.
And, to give you a time range, and I'll speak from myself from many years back when I got the certification. I think even when I was doing 14 hours work days, I finished the program in a couple of months.
Okay.
Passed it on the first try, and I've had folks that said it took them about 5 months. I haven't heard longer than that. That's why I was saying it's a great course that should be integrated in a university program.
Okay. And as people complete the course and they become certified, I assume to keep their certification, they either have to gain so many continuing education credits or retake the examination. What does the association offer in terms of opportunities for getting the continuing education units to keep their certification up?
That's again one of the great benefits of this association. And it's not costing an arm and a leg for nurses. The conferences themselves offer 14 to 18 continuing education hours, inclusive of the pre-conference. So when they have their certification, they're good to go for another I believe 3 years.
Okay.
And then when they're up for renewal, attending 2 conferences pretty much will give them the hours they need for the renewal. So, and we also have part of the benefits outside those twice a year annual meetings, we have quarterly live webinars. And that's, again, free CEUs that they can get. Also on the website, there are multiple CEUs free of charge that they can access.
Well, that sounds wonderful, and we're going to go ahead and put up the website, the exact web link, so that if people are interested in membership or certification, they can go to this website. But let's talk, just to kind of round things out, let's talk about the conferences. And by the way, carenational is a proud sponsor of AAMCN as well as the National Association for Managed Care Physicians. And so we will definitely be attending both the East Coast and the West Coast conferences. And the East Coast is coming up here in just a few weeks in Orlando, correct?
Yes. May 3rd.
May 3rd in Orlando, and then the fall one is typically held in Las Vegas. So anybody that's interested in attending these great conferences, it's a great opportunity to network as a managed care nurse or managed care physician. And there's a reception. Tell us a little bit more about what else is offered at the conferences.
The conferences are, many nurses get invited complimentary as well. But the conferences are the Spring Forum in Orlando, nice places typically, Gaylord or Disney or other, and the Fall Forum in Vegas, which is what everybody likes, Bellagio, Mandalay Bay, Caesars, but mainly Bellagio has been most common venue for that. And what they offer typically is in line of all these 4 groups that I mentioned earlier that come together in these meetings that add to that value of information sharing and networking. Typically, we have different tracks. We have the clinical track, the administrative or business track, as well as the oncology or genomics. It's sort of provide for the variety of membership background that we have, whether the member is line staff person or clinician, practitioner, or whether the member is a senior leadership role or executive role, or even, the regulators. We have membership from entities like CMS or state regulators, and membership from accreditory agencies like NCQA, URAC, Joint Commission. So regardless of the background of the membership, this variety in tracks addresses the different needs. I find often I chat with attendees as a board director myself, when they ask, I'd like to attend this one, but I also like to attend that.
Yeah, that's
What
a
should I
common
do?
dilemma at conferences for sure.
Yes, yes. And I say, think of it as, there is nice to know and must know, I need to know. And what is it that you need at the moment to take back to your work setting and share information? It's just exciting, energetic, meeting at the conference, and where clinicians, come together and sharing best practices or innovative way of doing something. It's kind of hard to sum it all in few words. It's just a joyful experience. I personally enjoyed most the networking that we have, whether it's the evening reception. We have great sponsors. CareNational has been one of the great sponsors that we've had over the years. And
Thank
it's
you.
a joy to network with the sponsors as well, because oftentimes they have great information for us clinicians, that we take back to the practice setting and share with our colleagues.
Yeah, absolutely. We've been to several of the conferences over the years, and we always, even though we don't always attend, all of the sessions, we get a lot out of the networking opportunities, the opportunities to meet people that we've worked with before and have done transacted business with over the phone, but we've never met in person. So it's our chance to get out and actually meet people and attend that. And this year sounds like it's going to be just as good, if not better, than years past, and we're very excited about that. If people wanted to get involved, now you're a board director, and so I'm sure you have responsibility of kind of creating some of the programs that happen at the conferences. If somebody wants to get involved in a volunteer level, and just be more involved in the association, what are some of the resources, or where could we direct those people to?
Well, the website itself, AAMCN.org, has links to that. We also have the VP of Educational Services, April, who's always available and easy to reach via email, phone call. Also board members, we circulate among the membership and different track sessions to kind of network also and make ourselves available. So I always encourage conference attendees to look at the name badge, and board members have the ribbon as board members. We also have tables that board members sit on, and other staff in the Managed Care Association to help attendees, reach out if they like to volunteer, if they like to be speakers, if they like to write and publish, which we do also as board members. We have our criteria for scholarly writing and publishing that we go by when we review, write-ups by folks that have submission for an article or something. The opportunities are vast in terms of volunteering. We have leadership committees, education committees, membership committees, and I encourage always members to just reach out. If you have a question, the resources are there.
Perfect.
By the way, one of the benefits too that I meant to mention is The website also have resources for case management, since you asked that.
Sure.
And I have found from my roles working with different systems, I always encourage them to use these resources and get their feedback, how it works for them. And the feedback has always been positive, that it does make a difference.
Wonderful. Well, we've been talking to Dr. Stefany Almaden today. She is a board member for the American Association of Managed Care Nursing, and their conference is coming up in Orlando on May 3rd. And Stefany, people are still able to sign up for that.
Yes.
If they haven't
Registration
yet done
is still
so.
open.
Registration is still open. Okay, so go to AAMCN.org if you are either a managed care nurse or managed care physician, or somebody that's wanting to get into managed care nursing. This would be a great place to start and network and find out about all the certification programs and etc. There's a lot more to be learned at their website, and it's a great resource. Again, we're very proud to be a national sponsor for the AAMCN and the NAMCP. And we'd like to thank you, Dr. Almaden, for joining us today on Managed Care TV.
Thank you. Thanks for your support.
All righty. We appreciate your viewership, and we'll be back next month with another great broadcast. We also have our HEDIS.TV season finale kind of broadcast coming up. We will be doing that on the 22nd. Did I read that right? 12th. Okay, that's going to be May 12th. Boy, I was way off. But hey, that's what live TV does, right? So on the 12th of May, I believe the submission dates are May 9th. So that's going to be a wrap-up show to see how the season went with HEDIS. And so thank you very much for joining us, and we'll catch you on the next Managed Care TV broadcast. Thank you.